Hello viewers, welcome to the academia. Today I will discuss the mechanism of expiration. So in our last video I have discussed about the mechanism of inspiration. Now today expiration. So in quiet breathing, expiration is a passive process, whereas the inspiration was the active process. So first of all, we can say that expiration is the passive process. We have seen it already. So it is actually a passive process. Okay. So, but when we expire forcefully, for example, voluntary expiratory efforts during exercise, during bronchial asthma, the muscles of expiration contract. So, what are the muscles? Basically, the muscles take very important part both in inspiration as well as expiration, and here also the muscles take an important role. So, these are anterior abdominal wall muscles, internal intercostal muscles. So, basically these muscles are taking important parts. So these are basically the anterior abdominal wall muscles, which include abdominal recti, transversus abdomini, internal oblique and external oblique muscles. Okay, and another is internal intercostal. So now the mechanism. Basically the contraction of anterior abdominal wall muscles, they increases intra-abdominal pressure and draws the lower ribs down and medially, thereby pushing the diaphragm upwards, thus aiding in expiration. So here first the anterior abdominal wall muscles, they actually help in the diaphragm uplifting. And next, below the diagram shows that how the internal intercostal muscles help. So they actually pass obliquely downwards and posteriorly from rib to rib. So the role of the second one is the role of internal intercostal muscles. So can see in the diagram. So on contraction, they pull the upper ribs down so that the ribs acquire the position, as we can see in the diagram at the end of the expiration. Okay. So some accessory muscles are also plays important role, and these are the adductor muscles. So the adductor muscles, they actually present in the vocal cord and they begin to contract early in the expiration, but their contraction is not complete. And what they basically do, they actually their main respiratory function is actually protective function. So these muscles are actually having protective function. What kind of protective function? So during respiration, they prevent the entry of food and fluid into the trachea. So what kind of protective function? They prevent entry of food to the food as well as fluid to the trachea. Okay. So if somehow the adductors are paralyzed, so fluid and food enter the trachea causing aspiration, pneumonia and edema. So their role is of protective. Basic expiration are done by the two type of muscle, that is anterior abdominal wall muscles and internal intercostal muscles. So hope you people can understand this brief description regarding the mechanism of expiration and role of the muscles involved in it. If you have any query and question, you can ask or can comment in comment box. So do watch the academia and wait for the next video. Till then, good night.